Hi, and welcome to the Shero's Collective podcast. I'm your host, Renee Sparks, and today I get to introduce you to someone who I've known for a little while longer than most of the others that I've spoken to, most of the other Sheroes. And this is someone who I've been watching. Her growth has been incredible over the years, and really her heart is out there. It's on her sleeve. She's making sure the world can see what it is she's doing. So hopefully this opportunity having a discussion here also helps to shine a light on this amazing shero. This is Debbie Myburgh. Her name isn't Debbie on her ID, but it's what she insisted upon having here. So I'm going to give it to you, Debbie, because you're right. People know you as Debbie. Debbie's an activist. She's a registered nurse. She's a member of NUPSO, which is a union. She's a training facilitator and a very passionate one. So we're going to be talking about that. She's the CEO director of D Health Projects, which has been around for a while. So we'll tap into that as well. A steering committee member of People's Health Movement and a passionate community member as well as passionate about community healthcare workers. So welcome, Debbie. It's been overdue, I must say.
Thank you for the invitation, Renee.
Okay, I'm going to go straight into it. I mean, you wear all these hats, right? But I think I met you in a space of capacity building in terms of healthcare workers and community members more so. Tell me, where did this come from? Where did you decide, well, I'm going to go out and train people or give people what I know a little bit of, because I assume that's it, share it with them and have them take that out in the world? Where did it start?
I think I can say it started, while I was growing up in Macassar. So Macassar is a community in Ward 109. And yes, with growing up and, working, doing voluntary work in the community, I think that is just the passion that I inherited from my mom, from my parents, and them raising us as, always give, always take, make sure that everyone around you is okay. So already at a young age, I was already working in the community. And so with that, growing up as a youngster, I noticed the needs in the community, because that is why you volunteer in the first time in the community, seeing the challenges and trying then to address some of those challenges. So what also happened, you saw, over the years how the population was growing. Many years back, it was, I think, a population of 44,000. Can't even give you the correct total now, but it has, I think, more than doubled when you look at the different areas that popped up within the community. And so with that, the infrastructure, the resources like your clinic, police station, social, those resources hasn't grown with the growth, like while the population was growing. That didn't grow. So it made the challenges in the community so much more. And then you look at the list of social ills. When you have the stats of Macassar, you will see that we have the highest rate in teenage pregnancy. We have the highest rate in even the abortion rate, your TOP rate at the hospital. We have all those stats. Gangsterism, high crime, and the main thing, the unemployment. So we know, something stems from something, that ripple effect, and then we get to the health. That is now where I come in, because now I'm a nurse, and I was asking myself, with all this voluntary work that I'm doing in the community, what else can I do to also address, using my skills as a nurse, to address some of these ills? And then I went to the unemployment one, because that one, a lot of things stems from that. Young people, if they're unemployed, they're going to, that is where also some of the crime comes in, because now this person needs to survive, so they will steal. We have a lot of young girls that are sex workers on the street, and we work, as I say, when I say work together, work with everyone. I will stop on the street and speak with the girl, and then they will tell me, that was not their first choice of work, but because they don't have work, that is the only way now they can have an income. so with that, there's also a success story coming from that, where one of the girls had said, I always wanted to be a caregiver, but I didn't finish school. As I said, one of the high rates is also the early school leaving, high rate of schools, early school leavers. So that means no matric, struggling to find work, can't continue further with studies if they don't have matric. So that is where my training comes in, to focus on getting them their foot in the door, to be able then to get to their dream. So the success story out of our girls, the lady that said she wanted to be a caregiver. She don't want to be a sex worker anymore, but she doesn't have another choice. We did the training. She is a caregiver today. She is almost now like a team leader for our sex workers, when we have when we work together. So with Sisonke, you mentioned earlier that I like to collaborate with other organizations. So working with Sisonke, they will pay a stipend for the sex workers for that day, and then we will have in my yard that we will have a workshop, and it gives me the time to do wellness screenings, because that is part of our organization, and also doing family planning while Sisonke is doing the workshop. And she's a caregiver today, and she's the team leader because she now mobilized the girls when there's an event, and she's a caregiver today. And so I know I'm with talking fast and having all these stories down in my mind. So now I don't know which ones to bring.
You've got a wealth of experience, and that is what is coming through. So don't stress about that at all. I mean, I think that the listeners would be able to feel the passion, because I mean, I can feel it from here. I just want to highlight to them, whoever's watching this, to know that Debbie's sitting in a lounge that's been converted into a training space. So, I mean, that's incredible. You are showcasing and showing us that it doesn't matter what resources you have. With whatever you have, you do what you can. I mean, I've seen that your training takes place in different venues. And is that again through collaboration, or do you have to pay for these spaces, or how do you manage to find these opportunities?
No, thank you for that question. There is no money to rent venues. The way how I get an income is when I apply at NPOs that have, short contracts, like for 3 to 6 months contracts. Then I go and work. I take that salary and try and invest and, buy my training material or my screening material. To come back to the different venues that you mentioned, I must take this opportunity to thank officials that supporting me in that way. It will be the facility manager at Macassar Day Hospital, Sister Viana, Sister Damon, Sister Moinkis. They allow us, not every day, but on weekends, when it's quiet at the facility, if we want to do practical work, there's a room in the maternity unit where we can use for practical work. In the tea room, we use when we do theoretical work. So I must say thank you to them. And then is the police station. That is now Captain Hutton. She's also someone that provides us the boardroom of the police station. So that is Macassar SAPD. And and when we do wellness, or when they have their staff wellness, I'm always invited to do maybe TV or talks or screenings, and that way we also, I can say, we're working together, because then now I can support them with their wellness, when there's wellness talks or activities that they need to do. Then we go there and do these activities. So who else? I don't want to miss out anyone when it comes to sharing. Oh yes, and then there's out of the box, it's Dr. Brioni May. I must also thank her because they started a school. It started as a street school in one of our areas in Macassar that is not much looked at. People don't. There's no activities or resources in that specific area. So she's the one that made sure that there's something happening in that area. In it's called Smarty Town, and they erected a big container, a beautiful container. They call it the Smart Hub. So in that Smart Hub, they do after our school, continue with the children that comes from school. They do in the mornings the ECD, what means for, yeah, duty day, and then they do have soup kitchen and all from the Smart Hub. You must see that area. So she will then also say to us anytime when we need the venue, it's there for the community. So that is Dr. Brianna May, I must say, from Out the Box, because they do a lot of work in Macassar. So how we collaborating is, when we do health talks. At one point, I was also invited to her activity in Somerset West, where I had to do a talk with young girls. So again, back to the collaboration, it is so important because you cannot work in silos in this industry that we are in. You cannot work in silos when you look around and you see all the challenges. And yes, I do talk about Macassar, but when you look at Ward 109, it's not just Macassar. It's your Sunflower, it's Deep Freeze, it's New Macassar Village, it's Belglen, it's Fori, it's a whole, and all these areas have the same, similar challenges. And it doesn't stop here, because when I advertise my trainings, then I get students from Khayelitsha, Nomzamo, Strand, Delft. I can't just, Somerset West, I can just name all the, all the surrounding areas, and then they will come to Macassar to do these trainings. So yeah, I'm trying to think what was the original question. So it was about the venue. I do get a lot of support when it comes to sharing venues. Yeah, the challenges or what we would like would be, a piece of land, because I've sent a letter to ASLA, because they previously used to build in our community, and now they are busy again with another project in Macassar. So I did have the meeting with the director. They had this container that they wanted to come and drop here by us, and I couldn't find land in Macassar. So that is our one challenge. Maybe I can, if someone out there hears that, that is the only part we're struggling with, City of Cape Town, just by providing us land, because we even said we're going to pay, rent for that land, because we need space to put a structure on. So now, in taking too long, ASLA had to take now that container, and they gave it to Salori Spas because of their community, what do you call that word? Yeah, so they couldn't hold on to, but that is how we lost that opportunity of having our own, yes, structure and so on.
Okay,
Yes.
but it will come. It'll come. I think I like the fact that you've taken us to how you access resources, which really is core to collaboration. You've brought that out quite well. I want to go and tap into your training a little bit more, because I know that you train community members to become carers, right? But what stood out to me about your model is that you wait for all of them to be employed before you start the next group. How how on earth do you manage that?
Yeah, when I started in 2022, I had very small groups. If I say small group, it's not more than 10 people in a group. And then it was only that 10 for the year of 2022. I did the same with 2023, small group, not by choice. It's, when you advertise, and you remember the target group will be, people that is unemployed, because we want to address unemployed, meaning that person doesn't have money to pay for the training. Then it will be, people from the low income bracket, someone that's maybe working at a till or that wants to do the nursing. So that is also where the timing comes in, doing it on weekends or after hours to accommodate those that's working on another place during the week. So I lost the point now. Sorry.
How do you go about making sure that they get employment and then start?
Sorry. That's what I'm saying. My mind is like going all over the place. I'm so sorry for that.
No,
so yeah, going back to what you were saying, I started nursing when I was 17 years old. I am now 54 and I've been in this profession for all these years. Meaning all these years, wherever I worked, I make sure that I build good relationship with everywhere I go, with everyone that I'm working with. Today, most of my colleagues, my ex-colleagues, they have their own businesses now, the primary health clinics, they have their organizations, their NPOs, NPCs, and imagine me going straight to these people and saying, I have students, I'm busy training them. Once they, qualified, we need jobs. So when there's vacancies, they let me know.
Wow.
They have openings for so many people or so many people. So that is why I believe relationship building, and now I can see the fruits of what, that relationship, because I can literally walk into any facility or organization, and I know it's all about you, your attitude, your professionalism, how you treat people, and even I incorporate that in my trainings. I say to them, to anyone that I'm training, whether it's now my trainings or the health talks or any talk in the community with young people, I say to them, I can get you to that point. It's your dream maybe to become a nurse, I can get you to that point, but it's you, especially when they do their practical part. I say you give it your all. You give it the all, because it's the manager or the assistant in charge or someone is going to see the potential in you, and then they're going to offer you the permanent job. So I'm trying to install, ethics, and I train caregivers as we were trained as nurses, how nurses were trained, because that is one and the same thing. There's no difference, the caregiver and nurse, there's no difference. So I do check, that's the curriculum I'm using. Yeah, to go back to putting them in a job. So yeah, with the smaller groups, obviously it was easy to place them. Then there was, and also what I do, I use social media a lot with the consent of the students. Obviously, when we do training, we take photos of what we are doing and we put it on the health page. And then there was one day, just some of the success stories where Group 5 construction, Group 5 is this big construction, and they say they saw. So that is why social media is really a good platform. They say they saw that I was training caregivers on COVID-19.
Yeah.
And they needed 5 people within that next 3 days. They needed 5 carers to come and be the COVID compliance officers.
Wow.
And they're asking me, what are the caregivers' rate? And you know me, I'm a caregiver advocate, and I know the salary that they are now getting, that basic, what is that, the rate that the government is talking about? I mean, you cannot survive on that. Now he's asking me, and I'm looking, and I'm like, okay, Group 5 is a very big, it's a huge company. And I tripled the rate. Wow. I tripled the rate, the rate that they say is the standard. I tripled the rate, taking my chance, triple, without any, hesitation, nothing. I made sure that they paid the caregivers, and not via me as an agency, but into the banking account of that caregiver. It was supposed to be a 3 months contract. That contract ended to be a whole year, and those caregivers, they are so more confident. So they are so proud. There's two that wants to go and work overseas now. So now I'm helping them with that. So sorry, I get excited because there is so much that is out there for the caregivers now. But if they don't have the support, if there's no one telling them, and even the training to make sure that the training that you do with them is relevant for what is out there now. Because I know there's a lot of training schools. I'm not even talking negatively about anyone or any training center, but my dream and my hope is for all training centers to like form a forum and working together. I know many don't want to work together, but work together, because at the end of the day, you want to make sure that this student is benefiting from this training, because we do get a lot of that comes to me with certificates, but they don't get a job. And then I see what it is that they were trained on. Then so now my job is to teach them out of community. Ask questions. Ask questions. If you see an advertisement, you make sure, is that company registered? Are they accredited? And I tell them everything that they need to ask to look for. And also the topic or the qualification. Will I get a job with this qualification? I'm looking for a thing that I can show as a certificate. Will I get a job if I now go to the workplace with this? And many of times it's no. Okay. Then they come to me, they want to do something over, and I said, no, you can't do something over. You've already spent this much money, you already spent this much time. I then just what is the word? When you test when you do just like an assessment, you go through like an assessment and you do a practical where they just demonstrate to see, if they are ready to go over, just for them to get the right qualification to be able. So it's very, very important to, like what I'm doing. You must tell me when I talk too much on one point. What I'm doing, I do attend meetings. I don't want to get the names wrong. Like, for instance, the civil society engagement, we attend that a week ago. That is now civil society, all the organizations with the health department. So when you're there, then you can speak with the people that can tell you what is needed now. And then I get also invited to the substructure meetings for NPOs and NPCs. Then also there you hear what is the need, what is it that they expect must happen in the community. And me being in the community, I also identify what is needed here. So when we're in that meetings, we then can talk about, like for instance, in that civil society meeting, I had a lot to say. I had so much to say, but that is the only way they can know what's happening on the ground for them to, when they do their policies, to so then they can say, okay, the community had an input, because when you're there, you have to represent the challenges. You have to talk on behalf of the community. So when I come back there, then I know what is it that they're expecting, and then I incorporate it in my trainings because it's relevant now. It's what they're looking for now. For instance, there's mind you, you were the one that mentioned it at one time, that you said, like for instance, that over the next 3 years, then the CHW needs to also be equipped with HIV counseling skills, because they're not going to appoint a counselor and a CHW. They want this one person to be able to look or to service this client holistically without doing the one thing next. Someone must come, but this person. So now that is also where the HIV counseling training comes in. Now there's a lot of CHWs that are requesting for this training, for the HIV counseling training, because it's happening. That thing that you were saying is going to happen, in the next 3 years. I was starting to get myself ready because I knew you know what you are talking about, because you are there, and then it's happening. Now they ask for that. And what's so excited when I'm in the substructure meetings, then they will ask me, Debbie, how far are you with the trainings? Debbie, how far are you with this training? And then I said, it's not going that fast because I need the charts. Unfortunately, I have to chart. So I do come down a lot with the prices. And the reason why I can do that, as I said, I will work a little bit on the one side, take my salary, and then on the other side, I have an international donor. I have an international donor. She grew up in Macassar. She's working overseas now, but she wants to stay anonymous. I said, I want to show it to the world, you know. She said, please keep me anonymous, her and her family and her husband. They are all, yeah, let me not say too much because then I'm exposing her. She says she don't want, it must stay
But
anonymous.
thank you to her for what she
Like a monetary donation monthly.
Wow,
Every month.
that's amazing.
So I don't want to miss out, you know, the people that really makes us to be able to do this. Because as I said, as one person, there's no way you're going to do that. And then I also want to say, Sister Titus, Andrea Titus. I know there's names I'm going to forget, and I hope people will forgive me.
I have
That
to
really,
forgive you.
yeah, you know, all my mentors and so on. So, Sister Andrea Titus, she's one of the ex-colleagues that has her own organization now. Some of my carers that qualified, they're working in her organization now. And because of, I think, I don't know if I must boast or something, about the quality maybe of the training, but again, it's about that person because I can only lay the foundation, and then this person must then show, or you know, what is the word, for themselves in the workplace. She started in the community. She's working in the clinic now, and in Kelsriver Clinic, have her own consultation room, and she can do all the types of counseling. When the client comes in, she can do. She started as a CHW, but because we followed that one, that you were saying, within the next 3 years, she decided after that training she wanted to do the HIV. And with that being equipped, she's now working as a counselor in the Kelsriver Clinic now. And then I met the manager on outreach we had once in Kelsriver. And Sister Titus said to her, this is the one that trained Maralise. The Maralise is now the student that's what. And she said, what? And she can just, you know how you feel when someone gives you that kind of feedback. The same with Helderberg Hospital, because my carers, they also volunteered over weekends at Helderberg Hospital. And Mrs. I wish I could remember her name, but she's the nursing manager. She's the nursing manager. When I go there, she will tell me over and over how a pleasure it is to work, because as I said, I trained them as how we were trained, how our foundation was laid. So it makes them to be able to work in a hospital, working in a clinic, working at the NPO in the community, working at an old age home. That is, and also it doesn't stop at 2 months or 3 months, the training. Once they are done, once they have their certificate, they stay on the group, and that is where we continue with training, because all this work you cannot fit. You cannot fit in 1 month. You cannot fit in 2 days, 2 months or 3 months. It has to be continuous.
I was going to say to you, when I listen to you, it sounds...
Sorry?
No problem. I was going to say to you, when I listen to you, I can hear that there's more than just, even if it was a 5-day course, it's not a 5-day course. There's mentoring, there's supervision, there's that constant connection. And that is something that, from where I'm sitting, is a thing that is being spoken about in higher spaces, but it's not truly practiced. And here's a perfect example of, well, actually, if you really embed that from the beginning, ethics, proper principles, and speak about, you have a connection to me always. That is important. I think very often we kind of have people coming in, facilitate, cut the ties, move on. And that person is still lost. That person is still like, what the heck? How was I supposed to? I don't know how to navigate this. What do I ask? So I think for me, the gem that you kind of leaving is that constant connection. You haven't closed your doors to people because why your money was only valid for this period. And I think that is what makes a huge difference. Also, if I listen to the amount of passion that you're speaking about, I'm sure this is what you kind of pour out in your classes. And so I think if that is the person is the vessel busy receiving that, they have no other space for negativity. They need to show up. because you've taught them. So well done on that. Really, really well done. And thank you to the fact that you have a donor. We will keep you anonymous, but keep helping to do this, because that was one of the things that I'd wondered, how do you manage to kind of adjust your prices? Because I know many other trainers and it's not possible, but now we know. So, okay. So there are good people out there that can help. And I hope that
Yes.
they will look out for the other really great facilitators out there, or people who are doing incredible work that also need something like that. So to anyone who's able to, there are many more people like Debbie. And Debbie, we're happy that you are fortunate enough to have this person, but really, I hope that other people also get the type of support that you have right now.
Yeah, thank you. Yeah, and I think also it's about also the expenditure, because now the facilitators that are supporting me, I do use only, if I can put it that way, people that are specialized in that field. For instance, now with HIV, you can ask me anything about TB.
TB.
TB
Oh
is
yeah,
my
you're the TB queen.
TV is my life, is my food, is my everything. So now I have someone that is where HIV is her food. She's a specialist in HIV. And I don't know if she's going to kick me after this, but I am going to mention her name because she don't want to take any what is the word, like she doesn't have a rate, she doesn't want to take any form of payment, if I can, let me put it that way. Then she is now Sister Sylvie Jonkers. She's going to kick me. Sister Sylvie Jonkers, she has a list of, like, for instance, midwifery, CNP, CP, clinical nurse practitioner, and then the HIV specialist. She has a list of all these credentials, and she's the one that's supporting me with the HIV counseling when it comes. So I do the facilitators that support me on all the trainings. I make sure that I get in the people that are the specialists in that department, so that the student can only get the best. That is the aim, is for the student to get the best. And so you know that it's quality, it's the best, and this person is going to give it with passion. That person is going, because that's her field. So that is all. Sister Sylvie Youngest is a retired sister. She's still doing community work. She's still volunteering at the clinic. So imagine you surrounding yourself with people like that. So meaning you can't even think of stopping. You can't think of complaining. You can't think of oh, the challenges is too much. No, this is the time that you go, you even if you want the challenges, because you know it's going to make you stronger, because you want to know that behind that you did something, and that will be the achievement, or the goal, or just that feeling of it was a challenge. It looked like it couldn't be. So the same with first aid and CPR. With the previous group, we had the ambulance department. I don't know if people know that they rendering that service to the communities. You have to book them. So then paramedics, people that knows their stuff, that I'm introducing to my students. They must get it from the best. Then I don't know if you know, Sister. That is why I'm saying the good connections and the previous colleagues, Sister Sister Michelle Brown. She is licensed in with the what is that heart? But it's an international thing, but it's about the CPR and the and then when you do the CPR, you get then your certificate for, I think it's 2 to 5 years. I can't remember how long that certificate is valid. So I get in those people too. So when my students have their certificate, and I even put everything on the certificate, so that the employer can see what modules was done, who's the facilitators, and I put the facilitators' credentials there, so they can see now these people come from good hands. Yeah.
Wow. Absolutely amazing, Devi. I mean, I know you've been doing this work, but I didn't even realize all of the maneuvering. I know you were a networker, that I knew. But yeah, so thank you very much. If there was something that you could leave with someone who's thinking about doing something similar to you, or
Mm.
to those that are unemployed, that are thinking about what is out there for me? What would that be? What advice would you give?
Yeah, I would say, to someone that is unemployed that would like to do the training, you do get many people out there that sponsors that person to, now that I'm mentioning it, one of the students in 2022 was sponsored by her employer. And she paid the full amount of the training so that the person could then start. So that is also something that we look at, and at sending out sponsorship letters where we ask for a person to be sponsored. We also did that on 2 occasions, but I don't know yet what is the lesson to learn from that, because the person then don't finish. Those ones that got it like literally for free, they did not complete. So I don't know how can we do that, or can we go about that, because you look at the circumstance of the person and you see if this person can just get to this point, then she will be able then to look after her situation. So I don't know, there's something that we still need to work on, because you want to give everyone an opportunity, even for that person that doesn't that's unemployed. And then also on that note, I want to mention, I don't know if you know Mr. Frank Julie,
Yes.
if he's with the young people at work. So I've networked with them, and through him also, there's people from Northern Cape and Eastern Cape and where else that contacted me because they want this friend, because they know him, through that connection, and that connection that opened actually more doors. And then you did leave a point. What the message that I want to leave is for, when training centers can work together. If I stay here and you stay in Strand, you have a training center in Strand, and someone phones me, I must be able to say, but I must refer you to that person in Strand because it's closer for you, the student, then you don't need to give out any transport. So the same with the community, the people that I met now through Mr. Frank, from Northern Cape. So I'm already busy communicating with a connect. I have connections all over. So I tap into those connections and give them the scenario, so then they can start something on that side to make it easy for everyone that wants. Because when people phone you, it's almost like it's the first time they hear of it, but I'm like, but I know of training schools in all these areas, right? Yeah. So and then also with Mr. Frank Julian, them, they look at the unemployed youth.
Mm-hmm.
So they have, different activities where the youth can benefit. So, for instance, when there's courses, and then they will reduce that price that you already reduced, they will reduce it even more. They will reduce it even more. But because you have in that environment, you understand
Yeah.
why it's being done that way. And then just at the end of the day, to see this person, get their certificate and how proud they are, and when they're in the workplace, and then now they can generate their own income. And you don't even think of, if I reduce some more, what am I going to do? So you don't even think about that. So these are all people that I don't want to miss anyone, because really
I
I
see
have
you
many
looking and researching. Yeah.
many around me, and I don't want to miss really anyone. And I mentioned you already, you did a lot. I was working in KZN, I was working in Pumalanga, and I was doing my thing. So that is why I'm saying it's good to collaborate. It's good not to be scared. Yeah, that is the other thing. When people come to me, or someone will say, I was referred to you, I want to start my own training center. I don't do this. I don't do this, because the more we are, the more people we can reach. The more people we can reach, because there's many people that want these courses. I literally give. Then people will say, moenie vir mense so alles so goed vertel nie. Moenie vir mense, I give. There's people that can be a witness today. I send all my emails. Who am I registered with? How did I get to the because I struggled. Let me be honest. I struggled not knowing who must I contact. I had this passion. I was doing it on my own, but I didn't know how to to register. Who must I register with? And when you ask someone, then the person disappears and going to open their own thing because now I gave my whole profile, my whole everything. Why I'm asking this question? So now, if someone asks me, that person can just ask once. I give everything. They can then decide what to use, who to go to, and so yeah, people are coming to me, and I gladly share because the more we are and doing this thing the right way, and I'm putting the thingy on the right way. And then also when you train carers, that is also maybe advice I want to give the training centers. Make use of someone that is qualified more than the carer. I'm not even putting the carer down. It's not even about that. It must be someone that's in that field, having the experience, because it's easy to read a book and present it to the you need to mold it. So it must be someone that's in this field to know what they can expect and all that in the workplace. Then already you incorporate these things in your trainings, and then even the caregiver is going to give the same things that they were taught. But what if they have questions? The caregiver won't be able to elaborate on things. Yes, it's easy to do a blood. Oh, that's the other thing, because now because the caregivers, that's where the advocacy come in. They are being used in all different institutions now, clinics, hospital, in spaces where it was only like SANC registered people, like your ENA, EN, and RPNs, RNs, and then you had that boundary, you had your scope, and you cannot go over that scope. And now the poor carers, they must do everything that is being done by the nurses. And then at one point, once a question asked, at least they came down to pinpoint who takes responsibility if something goes wrong. Because as an ENA, you're not allowed to do certain procedures, and if you do it and something is wrong, there is going to be consequences. Now, with the caregiver, they are expected to do these things in the field. So now at least it's narrowed down that the caregivers falls under the boundary of the health department. Yeah. So now what happens? The health department, I don't know if I can say it online, the health department, I feel they pushes that responsibility onto the NPOs and the NPCs, and then the organizations, again, they have their own policies. So now when it comes to training, now we know health department, when they give the programs for the communities, they give the role, of the caregiver. So in there is literally your basic wound care, it's your vital signs. So that makes me then safe to train them on that. So now that is what I'm saying. I'm training them as us, how we as nurses were trained. And even after that, going to them in the field, make sure they understand the rationale behind this procedure, because anyone can put the cuff on. You see most of these things that you just
press the button.
You just say, quick start, they give you a reading. Can they interpret that reading? Do they know what to do, when it's an abnormal reading? What then will they real, all those things. So I do make sure that I zoom into these things. Wound care, I'm actually scared. So that is where the advocacy comes in, making sure that they have to get the right training, the proper training in those procedures, because it's expected of them to do it out there in the field. But now when something goes wrong, that is then where we zoom in, because we will make sure, did that person, you cannot just fire the person because something happened to the client. It's so complicated, because now you're dealing with people's lives. Yeah. You're dealing with someone's life now. Now, maybe someone that's not much equipped, going to a procedure. I know of cases, especially when it comes to wound care, where the person died at the end of the day, first amputation, and then after a small, simple wound. And who's taking the responsibility? Who's taking the accountability? So it's all those things, but I don't want to go off the topic of today. But I'm sure you're going to invite me another day for the activism side.
Absolutely. No, thank you very much, Debbie. I didn't ask you that many questions, but I think you've given us such a rich tapestry of what it is that you do and how it is that you've become so passionate about it. And I know that your passion is really within Macassar, which is a town in Cape Town. But I know that it is also beyond that. So you've already made that abundantly clear. I think my takeaways from engaging with you is that you have the heart for something that you're doing. So to anyone listening, it's about passion. It's about, is this something that I love? And am I able to pour that out into someone else? Collaboration
Oh,
is key. We are not
yes.
islands, right? And then really, I think what I'm also hearing from you is adaptability and flexibility. So seeing what is the data showing, what is it that our
Yes.
healthcare workers need? And then
Yes.
the last, but I think most critical part is the voice, allowing yourself to understand what it is that
Yes.
these
Yes.
individuals will have to go through, but then thinking about platforms that allow us to talk about that. And I think that's
Yes.
one thing about you that I have seen. I've seen it at play, even in workshops, is that you don't
Yes.
back down and you do give that extra. And I think one thing I want to give to you is to stop apologizing for having that and stop apologizing for having many words, because in actual fact, there's
Yeah.
richness in what you share. So thank you so much, Debbie, for your time, and thank you for gracing us as our shero. And yeah, we look forward to further engagement.
Thank you so much, Renee, for this opportunity. Thank you so much. I appreciate that.
No problem. To those listening, please like, share, and subscribe to not only Debbie, there are many, many, many more sheroes out there, but please do help us amplify these stories.